So good afternoon and welcome. I'm Danuta Nietetsky, Dean of Libraries, and I'm really pleased to welcome you to our Winter 2021 ScholarSip event. ScholarSip was launched in 2011 as part of the library's strategic goal to help build cross-disciplinary community at Drexel and to connect our dragons to scholarship. Each academic quarter, the event brings together colleagues from all colleges, schools, and many administrative departments for some food for thought discussions focusing on interdisciplinary research conducted at the university and for a shared toast to the end of the academic term. So if you forgot, make sure you have something that can be shown to give a toast by the end of my comments. It is incredible to think that 1 year ago tomorrow, March 16th, the university announced it would shift to remote classes due to the COVID-19 pandemic. March 16, 2020 was also supposed to be the day of our winter ScholarSip event, but we ultimately decided to postpone it until spring, at which point we also adapted the event to a virtual format. Although we're still not able to gather together on campus for ScholarSip events as we have in the past, we have taken measures to continue to meet over the past year. Today, 1 year later, we've adopted several precautions against the virus, and with the rise in worldwide COVID-19 vaccine distributions, there is renewed optimism that we might return to a new ScholarSip normalcy next academic year. Communications to help make sense of all the information available about the virus and evolving precautions, from wearing masks to getting vaccinated, is a critical element of fueling optimism about the future. Given the unique anniversary of sorts, the theme of this year's ScholarSip event series seems even more appropriate today: responding to COVID-19 through research and scientific problem solving. During each quarterly event, distinguished members of the Drexel community offer food for thought on COVID-19 research topics they have responded to the pandemic, both through original research and through adapting existing procedures to address its effects on various communities. After today, we have one more event for this academic year, which is scheduled for Monday, June 7th. Mark your calendars, Monday, June 7th, and will feature a session with Christopher Sales, Associate Professor of Environmental Engineering. Professor Sales, I always mispronounce Kristen's name, will discuss a new partnership between Drexel and SEPTA to enhance efforts to prevent the spread of COVID-19 on public transportation. We hope to see you there. And now I'm pleased to introduce today's thought-provoking speaker, Drexel Professor Esther Chernak. Dr. Chernak is an associate professor in the Department of Environmental Health in Drexel's School of Public Health and the College of Medicine. She is also the director of Drexel's Center for Public Health Readiness and Communication. Her academic work focuses on initiatives that enhance public health and healthcare capacity at the local and state levels, improve the preparedness of at-risk communities, build community resilience through partnerships between public health and community healthcare and social service organizations, and facilitate emergency risk communication. At the College of Medicine, Dr. Chernak is the director of the MD MPH dual degree program, and she also oversees a graduate minor in infectious diseases in the Dornsight School of Public Health. Prior to joining Drexel in 2010, Dr. Chernak worked at the Philadelphia Department of Public Health for over 25 years, serving in a variety of positions, including medical director and program manager of the Acute Communicable Disease Control and Public Health Emergency Preparedness programs. She also currently works as a physician in Philadelphia's community-based primary care safety net health system. Thank you again so much for joining us today, Esther. But wait, before I turn the Zoom co-host function over to Dr. Chernak, let us continue our ScholarSip tradition and virtually toast the end of the winter term. And so let us all raise whatever you have, whatever container you have for some fluid in it, to wish us all well for the end. Let's say goodbye to this winter term. And as I always mention to our faculty that are in the teaching side, as you're about to embark on grading those final exams and giving grades, be kind, be empathetic, and let's just get through the year. Congratulations to saying goodbye to the winter 2021 term. All right, Esther, are you all set? I think we
am. Thank you so much. What a kind introduction, and it is my pleasure to be the guest for this ScholarSips. I really think that our library system at Drexel is really one of the greatest strengths of the university, so I'm really honored to be your speaker this evening. And I'm going to be discussing a interdisciplinary project that I had the pleasure of working on with a number of colleagues at Drexel. And we studied the disaster communication needs of families who have children with special healthcare challenges. So I assume everyone can see my screen? Okay. And so this is a study actually that really originated in many ways out of my experiences working for the public health department in Philadelphia, where I spent a lot of time responding to public health emergencies and responding to big outbreaks, and feeling like we did a really terrible job, honestly, of communicating broadly with the public and the folks affected by the outbreak or the disaster. And I was particularly concerned around children with special healthcare challenges. And so this is a project that I conducted with my colleagues at the Dornsife School of Public Health, but also with the St. Christopher's Hospital for Children Center for Children and Youth with Special Healthcare Needs, the Drexel Autism Institute, and the Pennsylvania chapter of the American Academy of Pediatrics, in particular their medical home program, which is their program that provides enhanced services for children with special healthcare challenges. And it's a project that was funded by the Centers for Disease Control and Prevention. And I want to start by acknowledging the research team. I know we usually end with acknowledging the research team, but I always feel like that gets short shrift. And I really want to be able to highlight the phenomenal collaborators we had, because this was really a team effort. Dr. Renee Turchi, who is the Director of Pediatrics at St. Christopher's now, but also has been the head of the Center for Children and Youth with Special Healthcare Needs. Tom Hipper, my colleague and professor at the School of Public Health, who's an expert in risk communication. Renee Davis, who works at St. Chris and also the Dornsife School of Public Health and Maternal and Child Health. Philip Massey, a health communications expert. Jennifer Legge Matsura, who was our librarian fellow for the final year of the project and is now happily a member of the Drexel Library team. Leah Popek, our research manager, and Eileen Thompson, who is the program manager for the Medical Home Initiative at the Pennsylvania chapter of the American Academy of Pediatrics. Folks, Jennifer Plum at the Autism Institute, Rachel Seitz and Gabriella Grimaldi, our students, and a handful of colleagues at CDC. This was really a team effort over a period of 4 years. And it was a project where we asked 3 major research questions. We wanted to know, how do families who've got children with special healthcare needs prefer to receive information in emergencies and disasters? What are their preferred channels, their preferred formats, contents, and information sources? We wanted to know whether the medical practices and social service organizations that serve these communities have the capacity for disaster communications. What do they perceive the needs of their patients to be, particularly information needs? And how do they use current electronic health record technology and other technologies to support urgent risk communication for their at-risk patients? And within those questions, we wanted to know to what extent social media is a useful channel to share information with these at-risk communities during public health emergencies. And our goal ultimately, once we did the research, was to try to translate our findings to useful tools for families and for medical practices to use. And in many respects, our hypothesis was that with families with children with special healthcare challenges, the pediatric practice, their medical provider, would in fact be a trusted source and useful way to share information with families. So we undertook a mixed methods project, and we collected data between April 2018 and June 2019. You'll see that we finished data collection a full 6 months at least before the first reported case of COVID here in the United States. And we used mixed methods to study the information needs of families and caregivers, as well as the information needs and capacities of providers. So we surveyed nearly 300 families and parents and caregivers of children with special healthcare needs, and conducted 80 in-depth interviews with the same population, largely recruited through the St. Christopher Center for Children and Youth with Special Healthcare Needs, but also the American Academy of Pediatrics chapter here in Pennsylvania. And we also surveyed 230 medical practices and providers and conducted 5 focus groups with providers and representatives of emergency response organizations throughout the state. So I'm going to present the findings from the family and caregiver arm of the study with a focus on our infectious disease outbreak findings. I'll share briefly some of the highlights of our work with providers, and then, time permitting, demonstrate some of the tools that we developed based on our research. So just a quick description of our survey sample. Again, we had 297 respondents to our survey that we sent out electronically, and also supplemented with hard copies that were completed in waiting rooms of patient in practices. You could see we had 50% white, 20% African American, 31% Hispanic, a broad range of respondents across income strata, educational strata. In the survey responses, majority were urban, reflecting the large percentage of folks who responded from St. Chris, 62% family with more than one child, and nearly a quarter with more than one child with special healthcare needs. Median age of children was 10, and the majority of our respondents were from Pennsylvania and a handful from surrounding Mid-Atlantic states. And respondents indicated that their children had a number of different medical conditions, a total of 19, which we broadly categorize into these 4 major groups: dependence on assistive technology or physical disabilities, children living with chronic illness like asthma, diabetes, children with intellectual and developmental disabilities, and then children with autism spectrum disorders. And within those categories, we decided to dichotomize our results, basically grouping children with physical disabilities, reliance on assistive technology, and chronic illness into one category, and then children with intellectual disabilities or autism spectrum disorders into another category, with the thinking that these were probably the critical distinctions from the context of emergency preparedness, planning, and response. Kids with intellectual disabilities and behavioral issues would have different needs than children with physical disabilities, reliance on assistive technology. What this Venn diagram shows is that the majority of our kids actually had both conditions, that it was a very medically complex sample. Nearly 75% of our children actually had more than one medical diagnosis, and the overwhelming majority actually had both intellectual disabilities and physical disabilities. This is a little bit more complex than some of the CDC surveys that have been done among children with special healthcare needs, where maybe 11%, maybe 15% have more than one diagnosis. 75% of our children had more than one diagnosis. But this probably reflects the fact that we recruited our sample from special centers and practices that specialized in the care of children with special healthcare challenges. And just a quick description of our interview sample. Again, we conducted 80 in-depth interviews, broad spectrum, cross-spectrum of race and ethnicity, a spectrum of educational background, income background. We had a little bit more in the way of rural representation, 15% rural interviews, 85% were from urban or suburban areas. Roughly similar age of children, range of 1 to 33, but 8 was the median age. And we actually conducted 10 interviews with adolescents, directly without their parents. And again, a range of diagnoses. And you can see here on the Venn diagram, a little bit more diversity. 25 of our 80 had 25 of our 80 interviews were parents of children with physical or chronic disabilities. 31 had intellectual disabilities or autism, and then 24 had both physical disabilities as well as intellectual disabilities. So with that background, let me just segue into our major findings. And the first thing we asked was about source preferences. And here's some of our survey findings. You could see that nearly 61% of our survey respondents indicated that their preferred preference for information broadly, during an emergency, before an emergency, was their child's doctor. And after that, you know, the other people they identified were also members of the pediatric practice, their child's care coordinator, their child's social worker. 6% indicated their child's medical equipment provider was a preferred source of information. Nearly over 30% indicated that the local or state health department or emergency management agency was a preferred source of information before an emergency or around preparedness. And nearly a quarter indicated the American Red Cross was a preferred source of information related to either preparedness or just emergencies in general. Well, we asked this question in the survey by specific scenarios, and we gave, in the survey, we asked questions about general information sources around preparedness or emergencies broadly, and then we asked specifically, during an emergency, do you want specifically like a storm or an infectious disease event or radiation release? Who is your preferred source? Across the board, all of our respondents indicated that their child's doctor was their preferred source of information. And this ranged from around 60% in the storm and radiation scenarios to 84% in the infectious disease scenario. That's their preferred source of information in an infectious disease emergency. The other preferred sources were much less commonly selected, but they varied. And you could see here the second most commonly selected sources were emergency management agencies at either the local or state level, or FEMA or CDC. You could see in a storm, friends, family, and neighbors were the second most preferred source of information. And then after that, the response, the preferred source varied by scenario, but you can see included, generally accepted sources of information like the Red Cross, medical experts in either radiation or infectious disease, local emergency management organizations, friends, family, and neighbors, etc. And in interviews, these themes are reinforced and really extended, but across the board, what we heard from our families is that pretty much universally, the healthcare provider, their child's doctor, their medical practice was their most preferred source of information. And here's a quotation from a parent at St. Christopher's: "All the information, everything, and I mean everything that I needed to know to get my children came from St. Christopher's. Actually, St. Christopher's is my second home." And in a severe storm, parents also indicated that, of course, they rely on local news sources, emergency response organizations, but the most medically complex families talked a lot about wanting to hear from their child's doctor about what they should do, what the safe thing for them to do was. In an infectious disease outbreak, for the most part, physicians were, again, among the most highly regarded sources of information. Most families in our interviews indicated to us that during an infectious disease outbreak, they wanted to speak directly with their providers, making, by phone or even a direct encounter. They also rely on news sources in CDC, and in a nuclear power plant reactor event, news and government agencies would be their preferred source. And in an infectious disease emergency, families went on to, really talk about how they were particularly concerned about their child's unique healthcare condition and the degree to which that would be impacted by the emergency. Here's a representative quotation: "Definitely my healthcare team. I think that when you have a child or family member that has specific healthcare needs, you want to hear specifically how it will affect that person as opposed to the general population." And then the second two quotations reflect some of the concerns around vaccines or medications and the degree to which they're appropriate for their child and their child's health conditions. "I would want my primary to be okay with it. He knows about her and her conditions, and would this be okay? Wouldn't cause any problems. I would want to know, what is this shot going to do for us? Is it going to make things better? Is it going to make things worse? Is it going to keep us safe?" So this was a decided preference, in terms of information source during an infectious disease emergency. We also heard in our interviews that during many emergencies, but in particular infectious disease emergencies, there is a reliance on pretty much any source. As quickly as they could get information is what they need. So it could ultimately rely on really non-expert sources for information. And here's some illustrative quotes: "I would want to get my information probably from anybody. I don't have a specific person. Word travels very fast. So if it's a professional, that's one, but just regular people will share, they will do that." And more, perhaps more to the point, "Well, in an emergency, I wouldn't care who it's from. The first one who gives me information, I'd look for it." And I think this is kind of a harbinger of perhaps what we've seen in COVID-19, where people just want information. And that can lead, of course, to misinformation and promulgation of misinformation. Here's a very quick summary of the content needs by different scenarios. Again, probably no major surprises here. We asked generally, you know, what people needed to know, families with special healthcare needs. With respect to preparedness, families wanted to know how to prepare a disaster kit, how to get backup power, where to go if they had to leave their house. These were reinforced in interviews, but one of the biggest things that came across in our interviews were generally these folks did not feel well prepared. They had lots of questions about how best to prepare, needed more information, but they wanted really tailored information around their child's disability or special health care challenge. We asked a number of different questions around severe storms, whether people had to shelter in place, perhaps in the wake of a power outage, or even evacuate. And you could see the top content needs were things like how to manage if we run out of supplies or run out of medications. And in interviews, there were lots of questions specifically about backup power and generator availability. Families with kids who have sensory disabilities or intellectual disabilities talked a lot about their child's dependence on electronics and the concern if they were to run out of power. Lots of questions related to evacuation around shelters. In surveys, there were basic questions around where do we go? Can the shelter accommodate a child with special healthcare challenges? What do we bring? In interviews, we learned in a granular way that individual families have really unique concerns about shelters. Families with children with physical disabilities, particularly kids who rely on assistive technology, have concerns about power availability and infection risk. Parents of children with intellectual disabilities have real concerns about just the sensory overload in shelters for their kids. During infectious disease outbreaks, the big content needs, of course, were, does my doctor recommend the medication? Is the medication safe? Is it effective? In interviews, we heard more of that, but again, more and more information, more and more just reinforcement about how parents really want to hear directly from their child's doctor around their own specific child's risk for infection and how to mitigate that risk. And then in terms of nuclear power plant accidents, whether the community was at risk, is the food and water safe, whether you need to evacuate, those were the big survey findings. But of course, in interviews, we heard more about just how little people understand about radiation and the health risks related to radiation, what to do, whether to evacuate, whether to shelter in place. And we also asked about, would you shelter in place, and what if your child was at school and you were at home, and learned that, you know, parents, if they could speak directly with their child, were more likely to comply with some of those directives. Here's some more information by special healthcare need type. Again, these are just representative quotations. Parents of children with physical disabilities, particularly assistive technology reliance, you know, had real concerns about infectious disease risks in shelters, particularly children with feeding tubes assistive technology dependence. Again, I mentioned earlier the concern about intellectual disabilities and just the sensory overload of a crowded shelter and what that would mean, particularly for a child on spectrum. There are lots of concerns around power. Of course, that's the biggest concern for families who rely on assistive technology that is power dependent. Questions, you can see the illustrative quotes here. If you're talking about 1 or more days of outages, if I'm running with no generator, that vent's not going to last long, so I need to go to the hospital. It shows you that parents are going to not stay at home very long if they have no power and no way to back up that power. They're going to end up going to the hospital. And again, similar concerns around power, even with children with intellectual disabilities, because many children with intellectual disabilities are so dependent on tablets and other electronics for communication, particularly nonverbal kids, but also just for occupation, et cetera. And here's a quote, when the electronics died, that's the biggest one because you can only play so many games with my oldest nonverbal child. I remember years ago when Sandy occurred, there's a lot of parents with special needs kids that lived in that area that was affected. That had to be their biggest challenge. We also learned from families with limited English proficiency, concerns about the fact that much information might not be translated into their language. So there's real concern about whether or not they're getting the full story, the full information that English speakers are getting, recognition that there's multiple preferred languages in a household, and sometimes a household needs to get information in multiple languages. Concerns about cultural practices and the degree to which they might fly in the face of a recommended health behavior. Again, some of this is quite resonant with what we're experiencing now in COVID. And we did some of our interviews in the wake of Hurricane Hurricane Maria. So there was real concerns, particularly among our some of the Latino survey interview participants, just around the government's good faith in terms of responding to that hurricane and how that might translate into other disasters. Just to switch gears now and talk briefly about channel preferences. You can see most of our families got information from traditional media, TV, radio, but a fair amount, more than half, used just websites, and a large percentage also used social media, in particular Facebook. We asked specifically, do you use social media in disasters? Over 61% said yes, and another 40% said no, but I plan to. And we asked, what channels do you use? And they said Facebook and Instagram for the most part. But Facebook clearly is was the most commonly used channel. And then we asked, well, who do you follow on Facebook and social media channels? And interestingly, most follow news outlets, professional news outlets. A fair amount get information on social media from friends and family. Local and state health departments, and then you could say way at the very bottom, well less than 10%, they follow their own doctor on social media. So they want to get information from their doctor, but they're not going to follow their doctor on social media. We heard a lot about that in provider focus groups as well. And in our interviews, I think we were able to sort of expand on some of these findings. Virtually all of our families, as well as the adolescents we interviewed, cited the internet as the most common channel for general health information, as well as information in a disaster. And they'll seek out reputable sources, but they realize that this can take time and it can be hard to identify relevant information. And they'll often learn something or read something on the internet and then want to go back and check it out with their provider. We learned that most parents use social media. They may not necessarily have used it to seek out disaster info, but they're willing to use it if they can get it from a credible source. And the one thing I think we learned about, particularly from a lot of these families in the context of just general health information seeking, is that many of them participate in social media peer networks and groups with other parents, with kids with special health care needs. And that's a very important source of information, just generally for health information, and also during interviews. And you can see some of these illustrative quotes here. Sometimes you get stuff on the ground as it's happening on Twitter from people that are not necessarily friends, but it gets disseminated quickly. Another comment about the Philly Autism Facebook group and the utility of interacting with parents that are in the same situation. And some providers are on there also who can kind of actually guide and lead and ask for recommendations. We've also learned that many of these community peer network groups on social media don't allow providers. And so providers can't necessarily weigh in and maybe disabuse people of incorrect information, respond to rumors, et cetera. So these are kind of double-edged swords, some of these social media-based peer networks. Let me just switch gears and focus briefly on just some other infectious disease specific findings. You can see nearly 55% of our families felt that an infectious disease emergency, and I think the question we asked in the survey was a severe respiratory virus that would cause trouble breathing. Would that occur in the community? And nearly 55% at that time thought that an event like this was likely to happen within the community in the next 5 years. Nearly 80% believe that an event like that would be dangerous for their child with special health care needs. And 36% felt that their family was actually prepared to handle an event like this. And maybe 33% felt neutral about it. And in interviews, we could explore some of these themes. We learned that families, again, wanted tailored information around their child's special needs from their doctor. These are illustrative quotes here, quotes like the physician would be able to tell me what the direct impact would be for somebody with sickle cell. And they want information like in checklists of what they need to do to prevent infection. Again, information from families who've got medical equipment. What are our options? What should we do? This is an adolescent interview, the last quote. People with respiratory issues, should they stay inside, whatever. It might be reassuring to have that acknowledged, the need to address those issues more on those broad. I'm very fortunate. I have a care center. I have a great support system. I know where to go for this information. Not everybody is that lucky. Not everybody is that media literate. So a lot of these families, they don't like the general information that's kind of out there for the broad public. They really want information that's very specific and tailored to their child's health challenge. Lots of families talk specifically about a fear of contagion and exposure. And this, I think, in many ways foreshadowed some of the reluctance to seek medical care that we saw during COVID-19. Here's a quote: "He has respiratory issues that would obviously be our greatest concern. I would hunker down in the house and not let anybody in. When it's virus or flu season, I try not to make any appointments for her at all. We have to go all the way over to the hospital. So if it's an appointment that can wait until spring, I can make it wait until spring because I'd rather not expose her to anything." And we saw in the last year decline in routine childhood immunizations and a real challenge in terms of getting kids into routine child appointments. And I think this also speaks to how positively telehealth has actually been received in the last year. And again, lots of concerns around the use of what we call medical countermeasures. This is a locution that's developed in the world of emergency preparedness that no one else uses, but it basically refers to medications and vaccines to control the spread of a disease or respond to a health threat. And parents really want specific information about whether a vaccine or a medication makes sense for their child and their child's specific medical conditions. They want to know about side effects. They want to know about potential side effects and their child's medical condition, particular concern among families with children with autism, and also families with children who are on other medications and the potential for drug-drug interactions. And we even saw among a number of interviews, particularly of parents of child on spectrum, vaccine hesitancy. And here's two representative quotes. "I myself, my kids don't even get the flu shot. They get their vaccines. I have mixed feelings about vaccines due to my oldest. He showed signs of autism shortly after the MMR vaccines years and years ago, so I have mixed feelings about it, but I understand the need for it. But the flu vaccine, my kids have never been on antibiotics, so I don't see the need unless there's somebody who's very, very ill frequently on needing something like that." And here's another quote: "I'm going to tell you that I wouldn't let them vaccinate the girl. Oh no, I don't think so. I would have to be there. I would have to see what's going on and what would happen. I would have to see what type of vaccine it is and what type of reaction it could have, because she got very sick with flu vaccine and so did I. So that's why I don't believe in those vaccines." And I can tell you in these interviews, we didn't solicit questions around vaccine hesitancy. We asked sort of general questions about what would you want to know, and this is what came out. Let me just switch gears and just give you the kind of 30,000-foot overview of what we learned in our provider survey and focus groups. There were varying sense of responsibility of what providers thought their job was or the responsibility was in terms of providing information to families with special health challenges during disasters. In particular, I think providers felt that they could help families be better prepared for disaster. And I think they all recognized, certainly in an infectious disease event, that they might be the right person to guide their families in disasters. They recognized that parents wanted information from them directly, and that although that might be scenario specific, and they recognize that it's challenging to meet those expectations. It doesn't take much to overwhelm the phones in a medical practice. Many of them use recorded phone messages and the practice website to communicate with families, but many of them had really limited technological resources to urgently communicate to large numbers of people in their practice. They recognized they had limited time in a patient encounter, a 10 or 15-minute patient encounter, to really help families prepare for a disaster or answer many, many questions. And many of them felt like they didn't necessarily know what the best advice was to give families with kids with special healthcare challenges during disasters. And they needed information and education. You can see here, unfortunately, they want to hear from you, one-on-one phone call or one-on-one office visit. When you have 100 people wanting that one-on-one phone call, we may not meet those expectations. We did hear from providers that were particularly technology literate, that some had actually really harnessed some of the newer technologies that are available for medical practices. And they use multiple platforms concurrently to communicate with families, both before disasters as well as during disasters, combination of social media, the practice website, text message services, their patient portal that's linked to their healthcare record, and email. In many ways, cloud-based technologies are a huge advance for the medical practice. I mean, particularly the days of having paper charts in the basement that get flooded in a large storm. I mean, those days are over if you have cloud-based medical records. But practices really told us they wanted to do better at this. And providers said they want training in communications. They want training in how to use technology more efficiently. And they wanted succinct checklists that they could give to families, particularly around how to prepare. And they wanted better integration with local emergency response organizations. They want a better sense of what's happening locally. They want just-in-time information. They want to know what is available for their families at the local level. And they also wanted incentives to be able to counsel parents during the context of a medical encounter. Incentives like reimbursements or tracking of whether or not tracking of effective counseling in the context of, say, quality assurance measures. In the interest of time, I'm just going to quickly jump to the final, some of my final slides. But I just want to point out here, the one thing practices said to us, we said, what should government agencies know about your role? And they said, they should know it's a partnership. What we have to offer, we're more than willing to digest and get out to patients. So they're telling us they want to be, they recognize that they're the trusted source for families and for parents. They want to be thought of in that way. And they also want the emergency response organizations to understand something about the unique needs of their kids with special healthcare challenges. And they said to us, it's important for them to keep in mind when they're doing emergency preparedness to think about the typical family that doesn't have all the other bells and whistles that come along with what comes along with the special needs family, all the technology that's associated with that and equipment and other things in the event that they would need to evacuate and what that means. So we heard from both the providers and families that they want easy to digest, clear information that's targeted to their child's health needs. They like bullets and checklists. They don't want 30-page documents on how to prepare. They want something they can tack to their refrigerator. Providers want materials that they can give families during an encounter. So we undertook a process where we dove into our qualitative data, identified needs, and narrowed our content. With Jennifer Legge-Matsura's help, we conducted a major search of published as well as gray literature and all the kind of tech manuals and tools and guidance documents that are kind of out there. And then kind of refined that information into easy to read, what we think are useful tools and guidance documents that would help families with special healthcare challenges. And we created some documents and then actually convened a number of additional focus groups and tested those tools and messages with parents and with providers to get feedback on whether this was the information that they wanted to know. Was this the format they wanted to see it in? Did it make sense? What did we miss? And we asked providers, would you give this out? Does it hit the notes that you think parents need to know? And so we developed a handful of checklists, both for families and for providers, and I'll just show you quickly what they look like. Here's a disaster preparedness checklist for families with children with physical disabilities. There are versions of this specifically for families who've got children with intellectual disabilities and also versions for kids with visual impairment and hearing impairment. So we have a number of iterations of these that we think address some of the concerns of those families. And there's some general information, specific recommendations for how to plan around power-dependent equipment, how to evacuate a child, and even helping a child cope. And I can tell you some of the sections around helping a child cope came out after COVID, where families have told us, we are struggling during COVID. Our kids are really struggling emotionally. We're having stress, et cetera. So we added some of these coping sections really in large part because of the COVID-19 pandemic. We did a one-pager on know what's in your community. And this is a template that uses Philadelphia as an example, but, information like, there's a local 911 call center that you can pre-register with, how to sign up for the local emergency management agency text messages, how to communicate with your utility provider, how to get social services agency if you need them, how to do poison control, and just the resources in your community. We found that a lot of families just didn't know this and wanted it in one place. We did some FAQs on emergency evacuation shelters, since this is such a pressing concern in the context of evacuation. And I'm sure everyone knows just from reading the news, we've had a couple of episodes just in the last year happily not here in Philadelphia, where in the middle of COVID, people were evacuated to emergency information shelters. So this turns out to be more relevant than we thought it would be. And then finally, we did a one-pager checklist for pediatric practices that basically just focuses on two things. One is just basic emergency preparedness for practice essentials, and there's lots of information out there to which we referred, but just things like updating the practice plan and making sure you're connected with the local emergency response organizations, but then a set of recommendations for how to help their patients before and during emergencies, using routine visits to guide preparedness planning, recommendations for how to use the electronic record to prompt that kind of counseling, but also things like plan for how you're going to communicate with families before and during emergencies, and set those expectations up so that parents know how to get information from the practice during the emergency. And we gave a number of checklists and recommendations as well. So those are our tools, and our next steps, of course, are disseminating our findings. We've got a manuscript that's in clearance at CDC that we're hoping to submit to the Journal Pediatrics in the coming weeks that has lots of recommendations for practices, many of which are focused on this infectious disease scenario because we think it's relevant for COVID-19. We'll be presenting our findings at a number of different meetings in the coming months, the Preparedness Summit and a Pediatric Academic Society meeting soon. We're really excited about distributing our tools. And we've gotten some agreement with CDC and the American Academy of Pediatrics to try to send out tools to both to providers and to families and some of our regional public health and emergency management partners. And then, of course, the interesting question of where does the research go from here? Dr. Turchi is leading a study that we're helping her with on the impact of home assessments on the readiness of families with special healthcare challenges. We're interested in some of the larger questions around, like, we have characterized this population. Be interesting to sort of return back to them and say, okay, post-COVID, what are their communication preferences? To what extent has this pandemic altered their communication preferences, but really to try to get at some of these issues around trusted sources and the source of just where does misinformation come from, and how do we best leverage a reliable, credible sources of information so we can disabuse people of some of the vaccine hesitancy and just some of the misinformation that we've seen so much in this pandemic. So that's a lot of information in a short period of time. I really appreciate your attention. And again, feel free to email me, and I'm here to answer questions. And I also have a number of my research colleagues here on our Zoom, and I think we'd all be happy to answer questions that you might have.
Well, thank you very much for that really informative and quite very interesting and so timely topic. So let's take a few minutes while we're all together, and then if it spins off some, maybe we'll have a little time too for some breakout sessions. So I know that some people put comments in their chat, which perhaps Stacy is more easily monitoring, but also somebody just raise a hand, and we can take a look to see who could start the conversation. Do you see any, Stacy, coming in?
There's nothing in chat just yet, but I'll keep an eye on it.
Why don't I start with one? I know we had a bit of a conversation beforehand, and this is one I personally am really interested to ask you. So I'm wondering from your research working with children at risk and their families might help inform our current challenges to communicate to members of our much more diverse and broader communities here in the city and elsewhere in the region, who are seeking to be vaccinated and how to do so. There's so many conflicting messages, and they keep changing so quickly, and there's different attempts to promote different venues, whether it's from local government run efforts to added partnerships with retail. It's quite interesting, or with the new FEMA, for example, just some starters. So how do healthcare specialists in communications best approach this kind of communications challenge?
Yeah, I mean, there's no single correct answer. I mean, my own bias is that I think the primary care community is underutilized here. And I think, you know, you have these public health information campaigns that are predominantly web-based, which has led to a lot of misinformation, I think. And I think I think it would be nice to have some clarity around, we have a lot of inequities and a lot of different ways of giving out vaccines across the US and even in our own region. New Jersey has its own approach, Pennsylvania has its own approach, Delaware has its own approach, and within Pennsylvania, we have county-specific vaccination rollouts that really differ from county to county. Everything from the way in which vaccines are being offered to how to sign up for a vaccine to eligibility criteria. Philly has its own criteria that are different from some of the suburban counties, and it turns out that there's differential access to vaccine supply. And I think just having some clear messaging that doesn't conflict, that's not inherently contradictory, is useful. I think being proactive and having clear messaging is useful. One of the problems we have in our media market is that we have a large media market, and a lot of people get information through the media, but there's really specific differences in terms of how to access vaccine if you're a Philly resident, if you're a healthcare worker, if you're a Montgomery County resident or a Delaware County resident. And I think it would be, I think we just need some clarity of information and just some clear channels. And I think just some agreement, perhaps, on the part of public health agency directors at the local and state level of what the methods are in terms of how to get vaccine. And what the messaging is going to be. One of the problems with relying on websites is that you're only going to get information to people who access the web, and that there's a lot of elderly people who don't necessarily access the web to get information, much less sign up for vaccines. There's a lot of non-English speakers who also don't just go to websites as well. So I think there needs to be some kind of concerted and pre-event. It would have been a good idea pre-event is for these folks to get on the same page and come up with some recommendations for just some consensus-based approaches for how they're going to get information out there. And I think, in Philadelphia, I don't think you really had a clear sense of how vaccine was going to be delivered. It became, there was a vaccine distribution that was kind of quiet to healthcare facilities, for healthcare professionals. And then there was this use of nonprofits that, was never really clarified, and then the nonprofits stopped. And then I think you just get this kind of messiness of, how do you get information? It reinforces this desire for people to pretty much get information from any source, regardless of what it is, just to get information, because it's not clear that there is a single clear source of information that's providing it consistently. And that's just dealing with the logistics of getting vaccine. The harder question is, how do you convince someone who might be hesitant to get the vaccine? And that's a kind of different set of information. There again, I think that there's something to be said for someone's medical provider, particularly among people with chronic medical conditions who have a connection to a medical provider. I think there's a relationship there that can be leveraged to basically to mitigate vaccine hesitancy, but also I think to get people clear messaging around vaccine availability, but that channel hasn't really been used.
Coordination of it would be great too. Does anyone have a question to present?
There is a question that came in through chat, and that is, can we find those flyers somewhere to share with families? There was a page shown that had 7 steps to register for 911 and PICO reconnection, etc.
Yeah, we are waiting for them to go through CDC's clearance, because CDC technically sponsored our project, and we have to officially go through the CDC channels. But we're hoping in the coming weeks that we'll make them available through our own website, through our Pennsylvania AAP chapter partners, and they'll be downloadable and free for distribution. So hopefully soon.
Do we have any others coming up? If not, we have a few minutes. People might want to feel more comfortable breaking out in some small groups. But let me just see if there's anyone who would like to pose a question or a comment. Others maybe from your group that would like to augment or reemphasize something that you've worked on.
Yeah, I saw Dr. Turchi and Tom Hipper and Eileen Thompson and Jen Legge-Matsura are here. Feel free to weigh in. Renee, maybe do you want to share with us some of your perspectives, or Eileen, with respect to the pediatric care that you provide? Anything I didn't add, or anything that you want to speak to with respect to during COVID?
You know, I'm going to do a little bit of while she's thinking, a little bit of a self-serving question. What roles might librarians have as partnering and helping with communication? We're known as a fairly trusted source of communication, of authentic, making sure that we're anti-disinformation, misinformation. And so where do you see the role of librarians perhaps in all of this?
Want me to answer that, or is that close to the group?
Yeah. Well, you in terms of your close work do it, but maybe others as well.
I think one thing would be, this notion of credible sources, in terms of, people looking to libraries as sources of information, and as clearinghouses for up-to-date and accurate information. And I think another is the librarian's expertise in terms of how to disseminate information. I'd be interested in your thoughts about that. What are we missing? I see Tom Hipper still on, and I don't mean to put you on the spot, Tom, if you're still available. Do you want to answer some of the questions around, I was interested in your thoughts about Januta's question around consolidating sources, and, your thoughts about just addressing some of the inconsistencies as a region that we've had with respect to vaccine information?
Yeah, sure. I think you hit the nail on the head with your response. I was just kind of reflecting on the past year, and to your point about how many things have gone so wrong in the risk communication space, and how we approach this project and what that could mean for a broader audience. And I do think, not to pat us on the back too much, but I do think that a concerted effort to better understand exactly who people want to hear from and how they get information, I think a commitment to making that an ongoing process and recognizing that answers to those questions change over time, and the available channels to us continue to evolve for some, while for others, many people feel left behind by some of these new channels. And so I think just reflecting on the risk communication piece, this is not going to get easier. And I think really being humble about the evolution of people's preferences and how they seek out information, who they want to hear from, and is going to be really important. And I think, as a city, speaking on behalf of the health department and our vaccine advisory group here, who have been, struggling with these challenges of how to effectively reach people, I think it's one of those things where we need to be thinking about how to be presenting clear, consistent information on websites and on various social media channels. We have to recognize that so many people, particularly those disproportionately affected and most at risk, are not using those channels. And I think it's a difficult balance to juggle at times. It really requires a broad approach, but only tapping into these non-disaster partners, healthcare providers being one, but certainly community-based organizations being another. Only by genuinely partnering with those groups can we effectively reach these populations. So that was just one thought to kind of extend on what you said. And I think also, obviously for this group, healthcare providers was far and away, no matter who we spoke with or how we sliced and diced the data, we kept coming back to the importance of doctors as a trusted source. And I think we've seen that that's maybe even more so the case with this specific group, but I think that's to Esther's point, a vitally important audience for the broader population as well, particularly in this vaccine space. And I think with respect to the issue of vaccine hesitancy, which I do think is, we're not quite there yet. Supply doesn't quite match demand, but we're coming into a phase in the next couple months where, we're going to have the supply, hopefully, and we're going to have people who, because of all these mixed messages, because of phrases like Operation Warp Speed, they're going to have legitimate questions, and it's going to be on the trusted providers of information like healthcare providers, I think, not just to convey clear information, but to listen and to be respectful of the fact that just because you have legitimate questions, just because you're not 100% sure about this, it doesn't make you, quote unquote, an anti-vaxxer who doesn't care about your health or the health of others. And so I think that empathy and respect, coupled with making sure we are leveraging healthcare providers as a trusted source and connecting them with the key messages we want out there in the community, is going to be really, really important now and going forward in this.
Thank you, Tom. I see we're running up against time, but I saw Kathleen Turner's hand come up, and I'd like to call on her as one of our librarians in this field. Oh, did she just, oh, there you are. I thought you just disappeared. Kathleen?
Hi, Esther and Tom, thank you. That was really very interesting. I'm just sort of curious about, balancing the, need for emergency level communication and privacy. Listening in on one of the city council hearings after the Philly Fight COVID debacle, and hearing members of city council continually asking the public health people who were present, well, why don't you just have lists of all of the people who need to be prioritized for vaccines? And it was almost kind of funny, because are they not aware that, no, the Philadelphia Public Health Department does not have lists of everyone's personal health information? So where do the barriers come in about protecting the privacy of families with children with special needs, or, adults with special needs when it comes to emergency communication?
It's a good question. I mean, and you probably know that, in the city right now, they've begun to collect information on a website. It's fairly broad, but they're certainly collecting PHI, protected health information, name, age, date of birth, some basic information around, underlying medical conditions. So they're maintaining a website of over 300,000 people, and in theory, referring to that when vaccine opportunities arise. I had huge concerns at one point, because they were, at one point, Philly Fighting COVID, this nonprofit, was doing that, and I had concerns about that. I spent a lot of years working in public health, and I know that within the context of public health, there's a great attention to securing personal information and protected health information in the context of public health surveillance and immunization data. But I think it's challenging, and I think you collect the least of the minimum amount of information you need. But it's also I think the challenge in a pandemic or emergency response, where you're actually giving a vaccine outside of someone's primary care practice. Ideally, if you're giving immunization within the context of someone's medical home, there is no need to release that information publicly.
Right.
In a high throughput, when you're in a situation where you're trying to immunize 10,000 people a day, and you're using public health department or emergency management agency department operated vaccine sites, you're going to have to share that information. And it's, but I think you collect the least amount of information that you need to do what you need to do, and you protect the information you collect. You're not sharing that publicly. You're sharing that with ostensibly a trusted party who is using that information for your health.
You hope so, yes. Yeah, thank you.
Dr. Churchy, did you want to add something from your perspective as a pediatrician who oversees?
Yeah, I mean, well, first I just want to say that, Esther, Dr. Chernak and Tom Hipper are just the most amazing partners. And every time I can't talk about disaster preparedness without saying that I am definitely, we've got like Yoda and Obi-Wan, and I feel like a Padawan. And it's just been such a blessing and an honor to work with them. And I feel like they've they've changed the landscape of Pennsylvania with the work that they've done in terms of children's special health care needs. So what a great, and also I think, you know, in this project, I will just say for me too, I have the utmost, and always have had the utmost respect for librarians, but just the librarian that's been part of our team and just what they've brought, it's really just shaped how I think a lot of us even have think about our work. So like just in so many ways, what an amazing partnership. And just with respect to the privacy, one of the things I would just add, Dr. Chernak, I agree with everything you said. One thing I was talking about a little with folks recently is just this idea of patient portals, you know, and emergency responders. And we did a brief emergency responder survey. And one of the big things that came out of that, and some of the work that we're doing is even building on all the amazing stuff that Dr. Chernak presented today, is that emergency responders feel particularly intimidated by when they are called to the sites of children with special health care needs, because while it's a small percentage of children, when they are really fragile, it's, you know, they're not seeing it as much as like an adult, let's say, with chest pain. So, but the stakes are high because, you know, it's they're seeing it less, but the children are so fragile. And so one thing and the information exchange is limited. So there's a lot of buzz about this idea of either registries or even thinking about patient portals, you know, where now you know, back in the day when I trained, people would talk about putting people's things on memory sticks, like your care plans, or having a printout. And now a patient portal, everyone has it on their mobile phone. So that you think that if you go into an emergency situation, you know, it's almost like instantaneous consent because the parent has, you know, the My Chart or My Tower Health or whatever it is app, and that can help in EMS. So I think there's a lot of layers to it, but I think the good news is this is where technology can really help us. So it's just great to be working with groups like yours. So great job, Dr. Chernak.
Likewise, thank you.
There was one more question, if you have time to take it, from one of our librarians. And the question was there any training provided about learning how to develop awareness of the different resources and then how to use those resources efficiently to get the right information? So when you were doing your surveys and stuff like that, did you provide training to any of the patients and their families, or was it just information gathering?
When we were doing the data collection, is that what you're
Yeah, and having the interviews.
Oh, you know, we struggled with that a little bit, but for the most part, we did the survey and we did the interview and got information. And then at the end of either the survey or the interview, if a parent had questions, we had a handful of resources to which we could refer them. You know, because we realized that a lot of this information gathering was going to be prompting questions and maybe even anxiety among some of our parents. You know, oh my goodness, this is terrifying to me. I don't have a plan, or I don't have this. And so what we did was we gave families a place to turn if they wanted more information about specific topics. And in many respects, what Dr. Churchy's now doing in her home assessment project is really the next step, where we're giving families much more in the way of guidance, documents, and tools to help them. And we hope that some of the deliverables in our project will be useful as well.
Well, this has been an amazing session, and we thank you very, very much again. I would like everybody to give Esther and her colleagues a round of applause. This has been just really a terrific scholarship session. So thank you so much, Esther.